Good. Okay, we got Keith in the office. Keith's in for neck and shoulder pain. Tell me explain what's bothering you.
I have shoulder pain underneath my shoulder blade. It pulls the muscle down in the tricep, so my tricep hurts and my upper neck hurts, but the pain's resonating from underneath my shoulder blade.
Stand up for a second. Turn and face the door. So he's getting pain. So we see that a ton in the office. A lot of pain between the shoulder blades at the superior inferior border of the scapula, which is really common right through here. I'll explain why. But that pain then radiates up into his neck. Some headaches occasionally.
Yeah.
Given some headaches occasionally. Some people have just headaches from that. A lot of times we'll get a lot of pain and pressure and tenderness up at the very top of the cervical spine below the occiput. But so he's feeling it. His subjective complaint is shoulder blade pain that radiates down his arm up to his neck and then down shoulder blade. One of the most common things we see in the office. So we're going to treat it. Go face down for me, Keith. So we're going to go right to the spot. Okay, we're going to go right to the soft tissue work on his shoulder blade. We use a little lotion, and it doesn't have to put a gown on or anything. We're just going to go right onto, again, that superior inferior border of the scapula, which is right through here. You have your levator scap, your rhomboid, and your trap muscles involved. So we're just going to kind of get where all those muscles attach and do a little trigger point work. You okay with that pressure, Keith?
Mm-hmm.
Just holding pressure. So, I mean, again, a lot of people when they have these symptoms might just take Advil, Tylenol, something to mask the symptoms, but you're never getting this fixed. Scar tissue's building up in your muscles, scar tissue's building up in your joints, scar tissue's building up in the discs. It's aging you at an accelerated rate in terms of how your spine functions, so you're going to have less range of motion, less strength, more pain, more problems if you just ignore this. You can take things to get out of the pain, but you're not getting to the root cause. So the main reason you'd want to come in is to get out of pain by getting to the root cause of the problem, right? So it doesn't keep coming back. And that's what adjustments and soft tissue and chiropractic care in general is going to offer you, is we're going to fix this problem at its root, which is joint dysfunction and wear and tear that's built up in the spine. Take a deep breath in for me, Keith. Exhale. Good. So just a really simple P to A thoracic adjustment. Just rechecking. Pick your head up for me. Yeah, right. Good. Okay, we'll come back. Go face up for me. So now we're going to do a little his neck adjustment, his mid back move right. Go left first. Just relax your shoulders, Keith. Perfect. And the side, let your shoulders relax. Excellent. So his right side is worse. Mm-hmm. In his right. So where his scalenes and his upper fibers of his trap, his levator scap, where those muscles attach up here, right below his mastoid process, right up through here, it's super tender. And I'd imagine, 90% of people have the same thing going on unless they're getting chiropractic care and they're just ignoring it. So we're going to do a little extra soft tissue work on his neck. So we're just getting, so the base of his skull is right here, his mastoid process, and we're going to gently go down, strip down the posterior scalene muscles, his levator scap, the suboccipital muscles. And, as you can see just from that angle that you're taking that, a lot of people are doing this all day. You don't even realize it. You're looking down at the screen. Mm-hmm. You're looking down at, our kids are in school with their heads down. And what is that doing to these muscles? These muscles are becoming shortened. And there's some people have so much tension built up in their scalene muscles. Their neck is, because their chin is always down, their neck's always forward. So the adjustments help correct that. And the soft tissue helps really get into those tighter spots on the scalenes and loosen them up. So if you're getting chronic headaches, if you're having TMJ, well, this works good for TMJ, so jaw problems, clearly, obviously, neck and shoulder pain, headaches, all those things have sort of common underlying, main problem areas. He adjusted so well. Let's see. A little soft tissue up here. And just the same thing on this side. Again, just got lotion. It's kind of working from his mastoid process, the base of his occiput down, and then his scalenes come way down. You have some of these scalenes come down and attach to your clavicle, and again, those are what become short. If you're head down all the time, those muscles become shortened. So we're gonna also, we'll get to this too, is give you some exercises to help stretch and retrain the ligaments and muscles of your neck. Very good. Just one easy traction. Pick your head up for me, Keith. Relax it. Just a little decompression with a towel. Just gonna hold it for about 60 seconds. You okay?
Mm-hmm.
Just taking the pressure off his discs. So your lower cervical discs, I would say most of the people I x-ray, the disc space in the C1, C2, C3, even C4-ish are fine, but it's this lower disc space that become degenerated, and they have disc space narrowing. So we want to take the pressure off that space and almost decompress, pull it back. So every visit, you're getting soft tissue, you're getting a neck adjustment, you're getting some decompression. Take a deep breath in, exhale. He moved right through here. Let's just make sure we got that upper one. Yeah, he's moving great. Going your side facing me, he's almost done. We're gonna adjust full spine because everything's involved. Take a deep breath in, Keith. Exhale. Good, other side. Deep breath, exhale. Good. Okay, so that's his treatment for today. We're gonna bring him back to follow up. We'll give him some exercises, ice, and so forth. But thank you very much, Keith.